And we're joined now by Dr. Deborah Birx, the White House Coronavirus Response Coordinator. Dr. Birx, good morning. It's good to see you. Thanks for being here.
Good morning.
Let's talk about what the president said in his press conference yesterday. You were right there. He talked at length about easing social distancing sooner rather than later, said weeks, not months. Is that advisable?
I think we're looking very closely around the world about specifically Italy right now because they're reaching their 2 weeks of clear social distancing and looking at the impact. We are seeing the number of deaths starting to decline. So we're in a space where people have made generalized recommendations for many decades on how to confront an epidemic. Now we're confronting a real epidemic, and we have to be willing to adjust our plans as we see impact.
Do you think it will be weeks, not months, that this social distancing will be required?
I think the question is really, can we be laser focused rather than generic across the country? In other words, can we use our data in a laser focused, granular way to really look at what's happening on the ground and adjust our public health messages based on what is actually needed by the number of cases and the work that we're doing with the communities?
Can you do that? Is it really feasible to isolate those hotspots and prevent the virus from spreading?
I think that is the question that we're all looking at very carefully now. So we're coming from models. Again, I said we've never really confronted this type of epidemic before that hit during a flu season, to really be able to dissect out what was flu, what was COVID, and really understand who was at risk and how they were at risk. And so we're getting critical information now from all of the front lines. We know in specific metro areas and all the areas that have rising number of cases should be following all the president's guidelines. Those were very clear. They were sent out over a week ago. And this is my plea to every American. Please continue to follow the presidential guidelines.
Are you confident that the president will listen to you, to Dr. Fauci, to Dr. Adams, the Surgeon General, if you were to say, look, we know it is a hard pill to swallow, so to speak, for the economy, but to save lives, we have to continue this lockdown? Are you confident he would listen to that advice and take that advice?
I am confident that the president has listened to and seen all of our data as it evolves. I think you can see that the president over these 3 weeks has been very focused on what the American people need, both economically and public health wise. And I think it's incumbent on every public health official to be looking at their data in a very granular way to understand who's at risk of hospitalization, who's at risk of mortality, how do we stop the spread, and really move to a 21st century supercomputing approach rather than a more generic slide rule-based approach.
But in the meantime, I mean, time is not on our side. As we are looking at that data, and certainly such an approach would be preferable, you have to continue to have this social distancing, right? I mean, I'd seen one estimate that says if you don't flatten the curve, we could have 2 million deaths.
This is absolutely correct, and that's why the president and the vice president yesterday kept coming back to what we need to be doing right now. What the president is doing is looking for the future and looking what we can do in the future, not looking and change what we're doing now. Please, he's made it clear, and the vice president, continue to follow the guidelines of social distancing and all of the other things about knowing where your hands are and washing your hands.
Let's talk about this phrase that's been said by the president and lots of people, that we can't have the cure be worse than the disease, meaning you can't have this social distancing and the economic lockdown and the shutdown of America be worse than what transpires when you have the virus. There's a doctor writing in the New York Times over the weekend, Dr. David Katz. He said the public health consequences of this near total meltdown of normal life will be long-lasting and calamitous, possibly graver than the direct toll of the virus itself. The stock market will bounce back, but in many businesses never will. The unemployment, impoverishment, and despair likely to result will be public health scourges of the first order. He is arguing that what doctors such as yourselves are advising right now is worse than the spread of the virus. Do you agree?
I think we're factoring all of those elements in, and I think there's a fine line and a place to go. that balances the needs of the American people both today and tomorrow with the reality of the epidemic. And that's going to require really precision, granular data, and that's what we're collecting now in order to really see that and understand that. To everyone in New York, you are in a very difficult place, and if any city should be adhering to the presidential guidelines, your governor and mayor, it's New York and the New York metro area right now.
Right now, New York they're getting positive tests back at a rate 3 times than what we're seeing in other parts of the country, correct?
And the reason this is we had a backlog. And so it's very difficult at this moment to interpret the test positive data because we're running tests. We got the high throughput up just now 8 days ago. We're running those high throughputs. There was a backlog. And so many of the positives that you're seeing in this surge are people whose tests came in 3 or 4 days ago. We're hoping to be able to move through that backlog soon.
Okay, Dr. Birx, before I let you go, the Surgeon General was on this show yesterday, and he was very blunt. He said he wanted to tell Americans it's going to get bad this week. Do you agree? And in what way? What should people expect?
So the cases you're seeing right now hospitalized, and this is a very important point for the American public, what we're seeing in the hospitals now are people who most likely got exposed and sick more than 2 weeks ago. So you're seeing what was occurring 2 and 3 weeks ago. So the things we have put in place over the last 8 days and what the mayor and governor has done over the last 7 days, you won't see the impact of that for at least another 7 or 14 days. And that's why you can't always just look at the hospital rates to determine whether you're having an impact epidemiologically.
All right, Dr. Deborah Birx, it's a busy morning. I'm glad you're feeling better, by the way. Thank you very much for being with us.